there's a handful of markers that are going to, of course, be influenced by our thyroid status, but one of the most clear is cholesterol. And so there's a few reasons for this, but essentially, we've discussed the impacts of a relationship between thyroid and cholesterol, where A, thyroid increases the conversion from cholesterol to the steroid hormones, and B, it increases the drop-off of cholesterol and also of fats from the lipoproteins to the peripheral tissues, and therefore helps to lower those things in the blood. And as a result, if our thyroid activity is low, we will tend to see higher levels of cholesterol, especially higher levels of LDL. This is a relationship that's been known for about 100 years, actually, I think a little bit more than 100 years, and yet has been completely forgotten or ignored by the conventional view, where now if we're trying to lower cholesterol or we're seeing high cholesterol, this is something that's totally independent of thyroid activity. Whereas in reality, if we can correct our thyroid activity, we can really lower our cholesterol values. So with all that being said, high cholesterol tends to be a very clear sign, or can be a very clear sign of low thyroid activity. And the part of the tricky aspect with cholesterol is that the kind of normal or ideal range changes with age, whereas we're getting older, higher cholesterol values are normal and associated with lower mortality and all of that. Whereas when we're younger, we want to have slightly lower cholesterol values relative to when we're older. We discussed this all in more detail in a couple of episodes talking about cholesterol, so I'll link back to those. But the important piece here is we can use these values as indicators of hypothyroidism. So that would be the first thing here. And then the other aspect of that is we can see shifts in these, or we want to see shifts in our cholesterol. If it is high, we want to see it come down if we're working on addressing our thyroid activity, whether through diet or supplementation or anything like that. We'd want to see that shift downward. And there is a kind of low end of the range that can also be problematic that we'll touch on in a second, but that would be kind of the high ends that would be looking at in terms of thyroid activity. So go ahead, Mike, if you have anything you want to chime in with.
Yeah, so a couple of pieces. So I would take the cholesterol element with like the other factors in conjunction, right? So looking at your TSH, T4, T3, your reverse T3, et cetera, and then also your symptom profile, because there are other things that can elevate cholesterol. It's just hypothyroidism is one of the major pieces. Now, something else that can elevate it is some type of low-grade inflammatory stimulus. It could be like a low-grade gut-derived endotoxemia or like the general metabolic syndrome profile. And so that can elevate cholesterol, but part of that mechanism can be through altering thyroid hormone signaling as well, because as we kind of discussed, cytokines, which are the inflammatory mediators of the immune system, can be released by endotoxin or other inflammatory stimuli. And then those can have a direct effect on the thyroid gland's production of thyroid hormone, as well as the regulation of TSH and then peripheral conversion of those thyroid hormones as well. So there could be a multi-factor profile underlying that hypothyroid state. It's not just pure hypothyroidism, but ideally, I would rather see somebody address like a high cholesterol level through dietary changes and through thyroid hormone use than using something like a statin or even like a red yeast rice or something, which I think has lovastatin in it, that like naturally occurring from the microbes that are fermenting the rice. So, and the reason why is, as we talked about, like from a mechanistic point of view, thyroid hormone is taking the cholesterol, bringing it into the cell, and then bringing it into the mitochondria. And so it's basically increasing that disposal of cholesterol towards the production of steroid hormones and for other cellular purposes. Whereas something like a statin or some of these other, or like a polyunsaturated fats are just lowering cholesterol exportation in terms of polyunsaturated fats by causing oxidative stress at ApoB, or it's basically decreasing cholesterol production at the liver by inhibiting the enzyme HMG
CoA reductase.
CoA reductase, yeah. I always forget the last part of it. But essentially, and there's problems with inhibiting those pathways. And I talked about this on a study, but essentially you can see like all the different compounds within the cholesterol synthetic pathway are involved in producing different components for different enzymes and energy metabolism and oxidative stress, directly involved in the deiodinase enzymes, and then also involved in vascular function and heart function and mitochondrial function, things along those lines. So it's better to take that cholesterol and convert it to something useful than it is to just block the whole pathway and not and basically have this whole list of negative downstream effects. So yeah, just to summarize, hypothyroidism is a major cause of elevated cholesterol. There can be other factors like low-grade inflammation or chronic inflammation or gut-derived endotoxin or things along those lines, or even dietary factors that can drive cholesterol up as well. So it's important to take those factors into consideration. You don't want to just look at cholesterol and determine hypothyroidism based on high cholesterol or not. You want to see the other values for thyroid and take a symptom profile. The other thing I just want to briefly mention is the correcting the hypothyroidism to lower cholesterol doesn't always look like taking a thyroid supplement. Both you and I, Jay, have worked with quite a few clients who've had sky-high cholesterols coming off low carb or carnivore, and then you bring carbs back into the diet, the hormonal profile starts to improve, and then cholesterol can drop from ridiculous levels. So people in the 300s, 400s can come down into the low 200s and have their cholesterol situated pretty nicely. And that's just from adding in the carbohydrate. And that's how powerful doing that is. And that wasn't even natural desiccated thyroid or synthetics required. And I guess a last tangential, or not tangential, but direct point is a lot of people are supplementing or being prescribed Synthroid for their hypothyroidism. And they may find that their cholesterol levels aren't dropping with the Synthroid and that their symptom profiles aren't improving. And again, it's important to understand this in the context of active thyroid hormone. Synthroid or levothyroxine is just T4. So if you're just taking T4 and you're not converting well, you're moving to reverse T3, or the deiodinase enzymes are shifted towards that D3, the D3 deiodinase enzyme, then you're not going to get active thyroid hormone in the form of T3, and then you're not going to experience any of the effects that you really want. The only thing you're really going to see is a suppressed TSH, which isn't a bad thing, but it's just not going to give you that active effect at the cells. Because again, what you really want to see is this effect at the cell. It doesn't necessarily matter what TSH is doing, because that's not providing T3 to the cells. It's what you really want to see is that T3 going to the cell.
Right. Yeah, those are some great points. And just to echo some of these things and kind of direct people to where it might be helpful, there are major issues to the statins. It is generally not an ideal route to go for lowering cholesterol. And we talked about the details there, all the problems that go with that in those cholesterol episodes. So I'll link to those. If somebody was just looking for a pill to lower cholesterol, I'd way prefer them to use a desiccated thyroid like Armour that's available as a prescription versus a statin. But as you're getting at, and as we'll talk about, you can improve thyroid function massively without going just to a thyroid supplement, whether it's T3, T4, or a desiccated product. And there are some negatives to just doing that without addressing the other side of things. So we will talk about that in some detail. But yeah, restoring thyroid function is an important piece here that is often overlooked when it comes to cholesterol levels. And that's why we can use cholesterol levels as an indicator for our thyroid status. There is another side of the cholesterol range that's important to touch on briefly, which is that if we are too low in cholesterol, that has its own negative effects. Again, we did talk about how important cholesterol is as a protective component. That's why it's increased in response to inflammation and infection and hypothyroidism and all of that. So we talked about that in those cholesterol episodes. But if we do have cholesterol that's too low, that comes with its own problems because of the importance of cholesterol in many functions, both in terms of steroid production, in terms of that anti-inflammatory and immune function, and also in terms of its importance in our brain, among other things. And so if our cholesterol is too low, not only does it come with its own problems, but also that can often or sometimes be indicative of a lack of cholesterol production at that point. And that can come with its own issues and is often associated with an underfed state. The reason why this is relevant here is that if your cholesterol levels are too far on the low end, and again, we're making generalities here, it's going to depend on the individual, but it's important to consider if your cholesterol is typically below 160, your total cholesterol levels, that is going to tend to be too far on the low end and will often correlate with an underfed state that can also involve issues with thyroid tolerance. So that might be a situation where you actually don't tolerate thyroid supplementation very well, which we'll talk about a little bit later. And so, and that's because you might not be producing enough cholesterol. You might be too low in terms of your fat intake or your carb intake as well. And so that's just another side of things to consider, where lower is not always better. There are costs there. And also it can be indicative of a state where we're not going to tolerate thyroid as well. And I did want to mention, again, there is this dichotomous effect where we can have high cholesterol from a low carb diet. And we talked about this previously, but you were kind of alluding to it. For me, I saw my cholesterol drop over 100 points from bringing carbs in. It was in the high 200s, around 280, and was, able to see it drop pretty precipitously, pretty quickly, without using any thyroid supplementation or anything. But there have also been points where my cholesterol dropped too far, and that tends to be situations where I'm a little bit prone to stress and don't tolerate things that might be a little stimulating, like thyroid hormone. So that's just something to consider. I know you have some parallel experiences as well, Mike. So yeah, just kind of the last piece here as far as cholesterol goes.
Yeah. But Jay, my cardiologist says that my cholesterol total needs to be less than 100.
And
so
it's just purely evil. I mean, there's no function for it.
Zero. It just causes heart disease. That's its only purpose.
Right. Yes, our bodies are just trying to kill us and don't have any understanding of science. So that's why they just raise the cholesterol levels willy-nilly.
Yeah. So on just a few points. If you're relatively young and your symptoms are going well and thyroid function's going well, you may find that your cholesterol level maybe less than 160 and you're fine. But if you're really on the low side, so as like parallel experience, when I was using thyroid hormone myself and I went too high in the dose, I had my total cholesterol under 100 and I absolutely felt terrible. It was like one of the worst experiences from a health perspective in terms of like mood and energy and things along those lines. So that's something to keep in mind, that it could possibly be low if things are going well, or lower than 160, particularly if you're younger. But if you're going to ever implement thyroid, you're probably going to want it a bit higher. And we can talk about some ways to help to increase cholesterol if you're struggling from that point of view. The next thing I just want to point out directly is the concern, and just briefly, about cholesterol and heart disease. And we have discussed this in a couple episodes, so Jay can link to those episodes in the description and whatnot. But essentially, it's not that cholesterol is driving the heart disease process. It's directly involved in that heart disease process. And so it's more of a function of what's going on with damage to the vasculature, and then the cholesterol having a function of kind of plastering over those damaged areas, and it also being elevated in states of that damage as well, or in states where the inflammatory response is leading to that damage, or in deficiency states, things like that. So the cholesterol is not necessarily the direct causative factor. There's other processes underlying that. And the other thing I wanted to point out is I just did a post on Instagram about this, but if you look at, so Dr. Broda Barnes has a graph in his book, Hypothyroidism, the Unsuspected Illness. And essentially what the graph shows is that when people are on natural desiccated thyroid supplements, the amount of heart attacks or coronary events that were expected based on the research in some of the high-risk groups or even the normal groups was drastically decreased. And so I think there's multiple underpinnings here. So the first piece is the thyroid hormone does help to lower the cholesterol to some extent into like a more normal range. But I think the more important piece here is that the thyroid hormone is elevating energy production, and that elevated energy production and state can help to lower some of the other stress hormone states and help to protect some of the vasculature and the cellular function from that damage, and help to reverse some of those inflammatory damaging states and things along those lines. Because it's not just the cholesterol reduction that drives this benefit. And you see that in the statin studies, right? In the statin studies, they're not seeing, except for a very specific subset of people, they're not seeing this massive benefit towards heart disease, mortality, and things along those lines. Maybe some less atherosclerosis. And I think, again, it's not, in what they're talking about now, even with statins, is it's not necessarily the cholesterol lowering effect. It's the other pleiotropic effects. So they discuss that are like separate from the actual statins effect on cholesterol. They're talking about it in terms of being an antioxidant or having effects on the gut or different areas. So I think it's even with thyroid, it's not just the cholesterol lowering effect. I think it's the other effects that are going on that are helping to improve the heart disease process overall. And again, Broda Barnes lays this out over, I think, a couple thousand of his patients that he's worked with who are on natural desiccated thyroid, showing that their level of coronary events like heart attacks was drastically reduced when they were on the thyroid supplement compared to the normal population.
Right. Yep. And we had recently discussed in terms of TSH, the correlation there, where any TSH level above 1.5 was highly associated or was actually above 1.4, was associated with increased coronary deaths. And there is a pretty strong correlation between heart disease and hypothyroidism. So definitely important to mention there. And yeah, we talked about that relationship or lack of relationship between cholesterol and cardiovascular disease in those cholesterol episodes. So I'll certainly link back to those.